I'm Staff Sergeant Stephen Still from the Defence Medical Academy. In this lesson we're going to talk about the roles and responsibilities of the non-vocational healthcare support worker. By the end of this lesson you'll be able to explain the roles and responsibilities, explain the limitations and explain the scope of practice for the non-vocational healthcare support worker. Okay, so the reason you're being trained is this. The NHS is currently dealing with the coronavirus COVID-19, which has the potential to put them over capacity and have a massive impact on the provision of medical care for the general population. This is the NHS Nightingale Hospital in London. This will be replicated around the country in other locations. It's being staffed by recently retired doctors and nurses, as well as military medical professionals. Okay, so your roles and responsibilities. You'll be providing support to the nursing team. You'll be performing basic nursing care. You'll provide assistance with non-nursing duties. So these are just some pictorial examples of things that you'll be asked to do, or potentially be asked to do. So you might be asked to conduct cardiopulmonary resuscitation or CPR, infection prevention and control, basic observations and history taking, signing consent forms, manual handling, moving patients around the hospital, and also care for the dying patient. So upon successful completion of this course, your scope of practice will be to carry out patient observations, perform basic life support, assist with patient safety and mobility, carry out infection control, gain consent from patient before providing care, maintain confidentiality whilst caring for patients, and also report safeguarding issues. You'll also provide care for a dying patient and their family. Non-nursing duties. You'll be asked to clean equipment, restock equipment, empty waste, replenish sharps bins, and manoeuvre patients around the hospital. Some limitations. You need to know your limits. Don't work outside your scope of practice. If you're unsure of anything you're being asked to do, please speak to a healthcare professional that is working at that hospital. What tasks are within your scope of practice as a non-vocational healthcare support worker? So in summary, you can explain the role and responsibilities, you can explain the limitations, and you can explain the scope of practice of the non-vocational healthcare support worker.